Good morning, thanks. So I'm supposed to talk about how to think about adding additional conditions to the WTC covered list, which is really addressing causation of disease. And disease causation is hard. It's hard for you to understand, and it's hard for us to understand. So let me just start with that. In fact, if you think about some new condition, forget WTC for the moment, if you think about some new health problem that you developed and you went to your physician for attention to that, and it could be pneumonia, it could be a fungal infection of your nail, it could be lupus or what have you, and you recall your visit to the doctor, my question is, did causation actually ever come up? Was there any discussion with the doctor about why did I get this? Why me? Why did I get this disease? What was the cause of this disease? And my guess is it didn't come up because what you spent your time talking about was diagnosis. What's the problem here? What's the nature of the problem? And also what the treatment is. What can we do about that problem? And that's right, because that's actually our priority is diagnosis and treatment. And my guess further is that actually you didn't even raise the issue of what caused this with the doctor because you knew that the doctor didn't know, or you knew it wouldn't be a fruitful discussion. And in fact, my guess also is in the World Trade Center, if you discuss those issues with your non-World Trade Center physician, the answer is equally absent of any information. And that's because disease causation is hard because we spent most of our time talking about diagnosis and treatment. In fact, you know, if you think about the past medical history, you think about that form you fill out when you go to the doctor or what the doctor reviews in terms of symptoms, there is no equivalent exposure history. They don't talk about what you were exposed to, World Trade Center or otherwise. They don't go talk about your neighborhood, your home, what job you had or the like. And the price we pay for that is ignorance, is that we simply don't know a lot about toxins and what they do. Now, I think it's useful switching now, I think it's useful to talk about how NIOSH looked at cancer, because NIOSH went through the review process with cancer and decided that cancer would be a covered condition. So let's just take a moment and review what considerations they looked at. First of all, they looked at the epi studies that Dr. Weber talked about this morning and others, Dr. Lucchini, the epidemiology studies, and they looked at the results. And in fact, the results were, I would say, preliminary because not that much time has passed, and there was a modest signal of excess cancer. Some cancers, maybe it was exposure related, maybe not, but there was a modest signal. So that's what the health studies of the workforce and survivors have shown us to date. Secondly, NIOSH looked at cancers we would expect to occur as a result of known conditions. So we had inflammation of the esophagus as a WTC condition. We know that that can cause esophageal cancer. So we're going to cover esophageal cancer because it's related to inflammation. It's a secondary condition, and that makes a lot of sense. And then they leaned on, and this is very important, the presence of known carcinogens at the World Trade Center site. So we knew asbestos was there, and Dr. Lucchini mentioned this. We knew PCBs were there, dioxin and the like. Now we knew that because there are decades of research on carcinogens which allow us to say that. You can go to NTP, National Toxicology Program online. You can go to their report on carcinogens, and you can see their review of hundreds of carcinogens and what we know about them and whether they cause human cancer or not. That results from decades of work that's been achieved by the scientific community. Try doing that for autoimmune diseases. Try finding the report on autoimmune diseases by any authoritative government or non-governmental agency, and you won't find it because it doesn't exist. We don't have that research as it applies to other outcomes besides cancer. And that's very important because it means we can't fall back on a body of knowledge that Dr. Howard mentioned, a body of knowledge to help make that decision about whether this condition could be World Trade Center related or not. And then finally, NIOSH used what we call plausibility and coherence, meaning did the toxin get to the site, to the target organ of concern, and does it cause biological changes that could cause cancer? And so we saw a lot of inflammatory conditions as a result of World Trade Center dust exposure. And we know that inflammation is a mechanism that can lead to cancer. So knowing those two facts, that WTC dust caused inflammation and that inflammation can lead to cancer, was important supportive evidence that cancer could be related to World Trade Center conditions. So how much more time do I have? I have no time, so let me continue. I just got 2 minutes. Mike Crane just gave me 2 minutes. Thank you. Okay, so in the workshop, we'll discuss this further, but I'm thinking about heart disease and WTC, looking at kind of these same factors that NIOSH looked at. Do we have epi studies that show increase in heart disease? Well, there's some evidence from the World Trade Center Health Registry. That's one thing. Can conditions related to WTC cause heart disease? Well, PTSD does raise the risk of heart disease, so that's interesting. Were there known heart toxins at the World Trade Center site? Well, we know air pollution increases the risk of heart disease, though that leaves a lot of questions about how dust related to air pollution. And then finally, is there plausibility, that is to say, could that dust have gotten to the heart or caused inflammation that could lead to heart disease on a long-term basis, not just in 2002, but in 2017? And that's a difficult question. So that's application of NIOSH's criteria to a different condition. And you can see it's difficult. It's difficult in part because we don't have a lot of information, and that information will evolve. My final point is, before Dr. Bromett cuts me off, is to emphasize, so the studies of the World Trade Center populations are key. The epidemiology studies, their surveillance work, the sentinel events that Dr. Moline mentioned before, it's key to us understanding and being able to cover conditions in the future. And we'll discuss this more at the workshop. Thank you.